بسم الله الرحمن الرحيم وبه نستعين. Assalamu alaikum everybody. In today's presentation we'll talk inshallah about the actions of cholinergic and anticholinergic drugs on different smooth muscles of the body. As we have explained in the previous presentations that drugs, they produce several actions. Some of them they are desirable action, therefore they are clinical uses or indication. And other action, in this case, they are known as undesirable action or side effects. Some of these side effects they should be avoided in a certain condition, and therefore they are known as contraindications. So that's what we are going to talk about, the actions and their classification into indications, side effects, and contraindication. We are going to speak about the actions in comparative way, i.e. we'll compare the actions of parasympathomimetics on smooth muscles with those produced by parasympatholytics. So before we speak about the actions, we have to know the mechanisms by which cholinergic produce contraction of smooth muscles. We have discussed that before. What we will have a quick revision. Muscarinic receptor on smooth muscles, they are of the type 3 M3 receptors, which are linked to GQ protein. Once the agonist binds to the receptor, it will activate GQ protein. GQ protein will activate a membrane enzyme phospholipase C, which will convert membrane phospholipid inositol diphosphate into inositol triphosphate and diacylglycerol or DAG. Inositol triphosphate, we have said it leaks into the cytoplasm where it will act on specific receptor present on the sarcoplasmic reticulum, opening calcium channel. Calcium will rush out of the sarcoplasmic reticulum into the cytoplasm. Once in the cytoplasm, calcium will combine with calmodulin, forming a complex, calcium calmodulin complex. This complex will activate myosin light chain kinase. Myosin light chain kinase. This is a kinase which is calcium dependent. Once myosin light chain kinase is activated, it will phosphorylate myosin, giving it energy. In this case, myosin will slide over actin, producing muscle contraction. So this is very briefly how muscle contracts in response to stimulation of muscarinic receptors. So now we'll talk about the actions. The first action is their action on the gastrointestinal tract, smooth muscles of the gastrointestinal tract. As we know, gastrointestinal tract, there is the upper gastrointestinal tract and the lower gastrointestinal tract. The upper starting from the mouth to the stomach, and the lower is the intestine, small intestine and large intestine. Usually the parasympathomimetics, they increase the peristalsis, they increase muscle contraction, i.e. they increase the peristaltic activity of the smooth muscles of the gastrointestinal tract. بالعربي البيرستالسيس الحركة الدودية للأمعاء. Okay. Now, once they increase the peristalsis, if this takes place in the stomach, they produce nausea and vomiting. This is nausea and vomiting. This is very famous side effects. This has no clinical application. This is a side effect. Some time ago, maybe 20 years ago, parasympathomimetics or cholinomimetics, they were used for treatment of gastroparesis and for the treatment of gastroesophageal reflux, but not anymore. This use is very limited nowadays. Therefore, when they increase the peristalsis in the lower part of the intestine, they can produce diarrhea. They can produce diarrhea. Diarrhea as well, it is a side effect. It is a side effect. These two side effects, nausea and vomiting and diarrhea, they are very common in toxicity with organophosphates, as we have said before. Okay? Now, the increased peristalsis, it has certain indication, has certain clinical indication. In cases when the smooth muscles of the gastrointestinal tract loses tone, this is known as atony. Atony of the smooth muscles of the gastrointestinal tract, or loss of tone, loss of muscle tone in the gastrointestinal tract. This usually happens after general anesthesia. After general anesthesia, especially in old people. So they will suffer from constipation and abdominal discomfort. In this case, they give neostigmine, which is anticholinesterase, quaternary amine with peripheral effect only, it has no central effect, or they give the agonist, which is beta-nicole. Beta-nicole is an agonist. Beta-nicole is an agonist at muscarinic receptor. Therefore, beta-nicole or neostigmine is used in the atony or loss of tone of the gastrointestinal tract, especially after general anesthesia. This is usually known as paralytic ileus. Is known as paralytic ileus. Paralytic ileus, which means paralysis of the ileum. Paralytic ileus or paralysis of the ileum. So these are the cholinomimetics, parasympathomimetics, acetylcholine-like drugs. They increase the peristaltic activity in the gastrointestinal tract. They can cause nausea and vomiting and diarrhea, and therefore they are indicated in certain cases of atony, of loss of tone of the GIT, especially after general anesthesia, where neostigmine is given by subcutaneous injection or beta-nicole is given orally. Okay? Now, the other type, parasympatholytic, which are known as anticholinergics or antimuscarinic or cholinolytics, all the same, or atropine-like drugs. They are known as atropine-like drugs. They have the opposite action. They inhibit peristaltic activity. They inhibit peristaltic activity. They inhibit peristalsis. They decrease the peristalsis. Once they decrease the peristalsis, they produce constipation, which is because inhibition of peristaltic activity in the lower intestine produce constipation. This is very common side effect. Most of anticholinergic drugs, when they are used clinically, they produce constipation, which is very common. Atropine-like drug, they produce constipation. MSAC, constipation. Okay. So this is a side effect. Constipation is contraindicated in cases where people are suffering from chronic constipation. Some people, especially in women, they suffer from chronic constipation. In this case, anticholinergic drugs should be contraindicated. Therefore, contraindicated atropine-like drugs, they should not be given to people suffering from chronic constipation, because they will make the constipation worse. Okay? Now, this inhibition of peristalsis is used clinically when in cases where there is high tone of the gastrointestinal tract, muscles, like in the gastrointestinal cramps. Gastro indicated when there is high activity in the gastrointestinal tract or gastrointestinal cramps. المغص المعوي, gastrointestinal cramps or المغص المعوي. And most famous examples, there are many examples, but most famous are propantheline. This is very famous. Anticholinergic, atropine-like. Dicyclomine. Hyoscyamin. And maybe the most famous example is clidinium. Clidinium, usually it is mixed with chlordiazepoxide. In treatment of intestinal cramp. Clidinium is anticholinergic. Chlordiazepoxide is a benzodiazepine with anti-anxiety effect. It decreases anxiety. Therefore, this combination usually produces a perfect action in gastrointestinal cramps. Okay? So, this is the first indication. They are indicated in gastrointestinal cramps. The second indication, they are indicated in diarrhea. Cases of diarrhea. As we know, diarrheal ishal, diarrhea usually happens due to several reasons, including intestinal infection. In this case, symptomatic treatment is done with atropine. Atropine, by inhibiting gastrointestinal tract motility, will decrease severity of diarrhea. In this case, atropine is usually mixed with another drug, with opioid, like diphenoxylate and loperamide. These are opioid. They are morphine, loperamide. These are opioid. They are morphine-like drugs. As well as we'll talk about them later, inshallah, when we talk about morphine-like drugs. These drugs, they inhibit gastric motility as well. Therefore, anti-atropine-like drugs or anticholinergic drugs, they have two important clinical applications. They are used in treatment of intestinal cramps and as well in the treatment of intestinal diarrhea. Okay? So these are the actions of cholinergic and anticholinergic drugs on the gastrointestinal tract. Now we'll talk about the action of cholinergic drugs on the smooth muscles of urinary bladder. Cholinomimetics, on one hand, will cause contraction of the detrusor muscle and relaxation of the trigon muscle. This will result in urination. Okay? So cholinomimetics, acetylcholine-like drugs, they produce contraction of the detrusor muscle. This is the detrusor muscle, will be contracted, and relaxation of the trigon muscle, which will result in urination. This is applied clinically, usually in post-operative urinary retention, when there is atony of urinary bladder smooth muscles, atony of smooth muscles of the urinary bladder, as in case of post-operative urinary retention. This is very common side effect due to the use of general anesthesia, where the muscles of the urinary bladder will lose tone. In this case, urinary retention will take place. Usually, in this case, the drug of choice is beta-nicol, given orally. Beta-nicol is given orally. This is the effect of parasympathomimetics. On the contrary, parasympatholytics or atropine-like drugs or anticholinergic drugs, they produce the opposite effect. So what they will produce? Produce relaxation of the detrusor muscle and contraction of the trigon muscle. Contraction. So what will happen in this case? Urinary retention. Urinary retention. This is very common side effect of atropine-like drug. All of them, or most of them, they produce urinary retention as a side effect. Okay? Now, this urinary retention is serious when the person is already suffering from urinary retention, like in cases of prostatic hypertrophy. Prostatic hypertrophy or prostatic hyperplasia, which is enlargement of the prostatic gland. When the prostatic gland they are enlarged, they will press on the ureter, making urination difficult. This is the prostatic gland. Once they increase in size, they decrease the flow of urine through the ureter, making urination difficult. Therefore, in this case, atropine-like drugs, they are contraindicated. Therefore, atropine-like drugs, they can produce urinary retention, and therefore they are contraindicated in condition where there is difficulty in urination, like the state of prostatic hypertrophy or prostatic hyperplasia. Okay? But this urinary retention, it has a clinical application. The urinary retention, it has a clinical application. They are applied when the person is suffering from active urinary bladder. Active urinary bladder. Usually, these people who have active urinary bladder, especially in winter, they are complaining of increased frequency of small volumes of urine because their bladder is active and cannot keep large volume of urine. Therefore, they complain of increased frequency of urination. This usually is known as urinary incontinence. Urinary incontinence. Urinary incontinence. Urinary incontinence, increased frequency of urination, which is troublesome, especially in old people. In this case, anticholinergic will be useful because they will decrease, they cause urinary retention. Most famous example is tolterodine, and physothirodine. These are anticholinergic drugs which are approved for the treatment of active urinary bladder. So these are the actions of cholinergic drugs on the smooth muscles of the urinary bladder. Second effect is their effect on the smooth muscles of the bronchioles. Cholinomimetics, usually they produce contraction. Cholinomimetics, acetylcholine-like drugs, whether they are direct or indirect, they produce contraction of the smooth muscles surrounding the alveoli. This will result in what's known as bronchoconstriction. Bronchoconstriction. This bronchoconstriction usually is accompanied by increased bronchial mucus secretion. Increased mucus secretion. Together, in high doses or in toxic doses, this might result in difficulty in respiration or wheezing or difficulty in the respiration. This happens when there is a toxic doses of organophosphates. They can produce wheezing due to bronchoconstriction and increased secretion in the bronchial tree. Okay? These effects, they are most dangerous when there is already difficulty in respiration, as in case of chronic obstructive pulmonary diseases, or in cases of bronchial asthma. Therefore, these drugs, cholinomimetics, should be avoided. They should not be given to a patient suffering from chronic obstructive pulmonary diseases and bronchial asthma. They are contraindicated. Parasympathetic, atropine-like drugs, they have the opposite effect. They relax smooth muscles of the bronchioles, producing bronchodilation. Bronchodilation or dilation, the same thing. Bronchodilation. Okay? So, these drugs, because they produce bronchodilation, they are applied in treatment of certain forms of chronic pulmonary diseases and bronchial asthma, usually. The most famous examples are the ipratropium-like drugs. Ipratropium. Previously, atropine was used, but not used anymore. Why? Because atropine can produce dryness of bronchial secretion, This dryness of bronchial secretion, the mucus which secreted by the bronchioles will become very thick, which can block small airways. Plus, atropine will inhibit the ciliary movement. The movement of the cilia responsible for clearing the airway passages. These two effects of atropine are not desirable. Ipratropium, on the other hand, it has no effect on bronchial secretion and no effect on ciliary movement. Therefore, it is the drug of choice in this case, ipratropium, and usually it is given by inhalation. So, ipratropium is one of the drugs. Ipratropium, it's like tropiums. There are different individuals or different drugs. The prototype is ipratropium. Ipratropium can be given by inhalation in cases of bronchoconstriction due to obstructive pulmonary diseases and bronchial asthma. Last thing is the effect of cholinergic drugs, smooth muscle of the uterus, where there is no clinical application in this case or contraindication, except that the cholinomimetics can increase contraction of the uterus, and this is most dangerous in cases of pregnancy, because they can terminate pregnancy if they are given in enough large doses, but this is usually is not indicated. Parasympatholytics, they produce the opposite. They produce relaxation of the uterus, and this, it has no clinical implication. Now we'll talk about the actions of cholinergic drugs on the smooth muscles of the eye, where there are very important clinical indication and contraindication. In this case, we should know the action of these drugs on vision of the eye vision, and on intraocular pressure. This is the anatomy of the eye, and we should concentrate on three structures. The first is known as the ciliary epithelium or ciliary process. The second are the ciliary muscles, which controls lens, and the third, the iris. Okay? Now, first, ciliary epithelium or the ciliary process is responsible for the production of the aqueous humor, continuous production of a fluid known as aqueous humor. This aqueous humor, there is a continuous flow from the posterior chamber, from this side, to the anterior chamber, this side, through the pupil. In the anterior chamber, the aqueous humor will drain through the trabecular meshwork to the Schlimm's canal. Okay? So, what will happen? So, this is normal. There is a continuous production of aqueous humor and continuous drainage through the trabecular meshwork. Okay? Now, so what will happen? If this flow is blocked for any reason, that means the pressure inside the eye will be increased. This will result in increase in intraocular pressure because of the accumulation of the aqueous humor. Increase in intraocular pressure. This is known clinically as glaucoma. Glaucoma, of course, there are different types of glaucoma, narrow angle and wide angle glaucoma. And glaucoma is very dangerous because if it is not treated, it can lead to blindness because of damage to the optic nerve. Okay? So this is the first. The ciliary process or the ciliary epithelium will produce aqueous humor. This aqueous humor usually is drained in the anterior chamber through the trabecular meshwork to the Schlimm's canal, and if this drainage is blocked for any reason, that lead to the increase in intraocular pressure in the eye, which is known clinically as glaucoma. Okay, this is the first. The ciliary process. Second, ciliary muscles. These ciliary muscles, they are responsible for the shape of the lens because they are responsible for the shape of the lens. Okay? Now, when these ciliary muscles, they are contracted, this means that the lens becomes round in structure, and it will be accommodated for near vision. Okay, this is one. Therefore, when the ciliary muscle are contracted, they will pull the lens, and the lens will become round in structure. Round means the lens will be accommodated for near vision. Okay? The opposite, if the ciliary muscles that are relaxed, by drugs, usually when they are relaxed, the lens will become flattened, and once it becomes flattened, it will be accommodated for far vision accommodation. Okay? Now, so what's the importance of the ciliary muscle? The ciliary muscle will determine the shape of the lens. When the ciliary muscle are contracted, they pull the lens, and the lens becomes round in shape. Round means the lens will be accommodated for near vision, i.e. the person will see near things and cannot see far things. Okay? Now, when the ciliary muscles they are relaxed, that means the lens becomes flattened. Once it becomes flattened, the vision will be accommodated for far vision. The vision will be accommodated for far vision. That means the person cannot see near things, can see far things, but cannot see near things. Okay? So this is the second. First we talked about the ciliary epithelium. Second, we talked about the ciliary muscle. Third, we'll talk about the iris. The iris. So what's the role of the iris in vision and intraocular pressure? What's the role of the iris? The iris, as we know, if we just imagine this is the iris, surrounding the iris is a circular muscle, which are sphincter. Surrounding the iris is a circular muscle. And as well, there is a radial smooth muscle. So the iris, there are circular muscle, which are cholinergic, innervated by cholinergic, and this is the iris. This is the iris. So these are the circular muscle. These circular muscle actually they are sphincters. They are supplied with cholinergic nerve. Once acetylcholine is released here, it will act on M3 receptors on the smooth muscles of the circular smooth muscles, produce contraction of the smooth muscle. Contraction of the circular smooth muscle, of course, the diameter of the pupil becomes smaller because it will contract towards the center. In this case, the diameter becomes smaller. This is known as meiosis. Okay? Therefore, stimulation of cholinergic receptor on the circular smooth muscles of the iris will produce meiosis. Meiosis means small diameter of the pupil. Small diameter. حدقة العين تولي صغيرة. Small diameter of the iris or the pupil. It's known iris or pupil. Iris. Okay? So this is the first. Contraction of the circular muscle will produce meiosis. Okay? Now, when the muscle are contracted, when the circular muscle of the iris here are contracted, they increase the angle of flow here. They increase flow angle for the aqueous humor. Flow angle will become larger. That means more secretion of aqueous humor through the trabecular meshwork. That means decrease in intraocular pressure. Okay? So generally meiosis is accompanied by increase in the flow angle in the anterior chamber, and this will increase the flow of aqueous humor through the trabecular meshwork, and this will result in decrease in intraocular pressure. Okay? This is first, which is cholinergic innervation of the circular muscles. Now, the opposite will take place with the radial muscles. Radial smooth muscles, they are adrenergic. They are supplied by adrenergic nerve and adrenergic receptor, where stimulation of alpha-1 receptor will produce contraction of the radial muscle. Contraction of the radial muscle, radial, they call it radial muscle. Okay? Contraction of the radial muscle will pull away the iris. That means causes mydriasis. Mydriasis. Mydriasis, okay? Mydriasis, increase in the pupil size. Mydriasis, increase in the pupil size, okay? Now, stimulation of alpha-1 receptor will produce contraction of the radial muscle. The iris will be pulled away, producing mydriasis, increase pupil size. Okay? Now, this when happens, the iris will block the flow. The iris will block the flow. The angle of the flow of aqueous humor will become smaller. Any mydriasis produced by any drug, it will cause the flow of a humor will become slow. Why? Because the angle of flow will become smaller. Smaller flow angle. That means will lead to slow flow or drainage of aqueous humor. Slow drainage of aqueous humor. That means increase in intraocular pressure. Increase in intraocular pressure. Okay? So, on either side, there is either a decrease in intraocular pressure by meiosis or increase in intraocular pressure by mydriasis. So, what will be the actions first of cholinomimetics, parasympathomimetics? What would they will do? So, once we start with their effect on the iris. Of course, they are cholinergic, therefore they will produce contraction of the circular muscles of the iris, and this will result in meiosis. Therefore, cholinomimetics, they produce meiosis. This meiosis is used clinically, preoperatively in ophthalmology. Before operation, they use acetylcholine eye drops before ophthalmic surgery. Before ophthalmic surgery. This is very common practice. Therefore, cholinomimetics, by contraction of the circular muscle of the iris, to produce meiosis, and these they are applied, indicated before surgery, before ophthalmic surgery. Second, by producing meiosis, they will increase the angle of flow of aqueous humor. They will increase here the angle of flow of aqueous humor. Therefore, they will decrease intraocular pressure. They will decrease intraocular pressure. This is an indication. This is an indication in treatment of glaucoma. In treatment of glaucoma. Maybe the most famous example is pilocarpine. Pilocarpine eye drops. Pilocarpine is a natural alkaloid, as we have said before, and it is used specifically for treatment of glaucoma, especially open angle glaucoma. Okay? Pilocarpine is a direct cholinergic agonist. In some rare cases, they use ecothiopate, which is organophosphate. It is anticholine esterases. Usually, ecothiopate is left for resistant glaucoma. Resistant glaucoma. Glaucoma which does not respond to other type of treatment. Okay? Actually, glaucoma nowadays, the best drug is beta blocker atenolol. Atenolol is a beta blocker which is considered as first choice in treatment of glaucoma, as we'll say later when we talk about beta receptor blockers. Okay? So these are the actions of parasympathomimetics. They produce meiosis due to contraction of the circular muscle. That's why acetylcholine eye drops, they are used before ophthalmic surgery. By reducing meiosis, they decrease the intraocular pressure, and that's why they are used in treatment of glaucoma, especially pilocarpine and ecothiopate. A third effect, these drugs, they will produce, as we have said, contraction of the ciliary muscle, and therefore they produce accommodation of the lens to near vision. So the person will see near things with failure accommodation of far vision. You don't see far things. This is very common with these drugs, usually because they produce contraction of the ciliary muscle and the lens changing shape, where it will be accommodated for near vision. These are the parasympathomimetics. On the other hand, parasympatholytics, they block cholinergic receptors on the circular muscle, on the iris. They block cholinergic receptor on the circular smooth muscle of the iris. Therefore, what they will produce, the opposite. Instead of producing meiosis, produces mydriasis. Okay? Now, this mydriasis is utilized clinically. It is utilized clinically in ophthalmic examination. Ophthalmic examination. When we need to examine the retina of the eye, usually they instill drops, eye drops, produces into the eye to produce mydriasis of the iris, pupil, mydriasis. This mydriasis to examine the retina. The most commonly used drug in this case are cyclobentolate, and tropicamide. Okay? So cyclobentolate and tropicamide are anticholinergic, which are used in ophthalmic examination. Why they are used? Because they produce short duration of action. Therefore, they produce less side effect of short duration, as we will see. Atropine, on the other hand, it has a long duration of action and therefore produce a long side effect. Okay? Now, therefore, blocking the muscarinic receptor in the iris by atropine-like drugs will produce mydriasis. As we have said, mydriasis means pulling of the iris, decreasing the flow of aqueous humor. That means aqueous humor will accumulate in the eye, increasing the intraocular pressure. The pressure inside the eye will be increased, which is glaucoma, as we have said before. Therefore, anticholinergic drugs, they are contraindicated in glaucoma. If the person is suffering from glaucoma, he should never be given atropine-like drugs. It is a contraindication. Therefore, anticholinergic drugs, they are contraindicated in glaucoma. Why? Because they increase the intraocular pressure by decreasing the flow of aqueous humor through Schlimm's canal. This is first. We said that they will block muscarinic receptor on the ciliary muscles. They block muscarinic receptor on the ciliary muscle. In this case, ciliary muscle will relax and the ciliary muscle will relax and the lens will become flattened and accommodated for far vision. Far vision, lens will see only far vision. Far vision accommodation. Okay? Therefore, anticholinergic drugs, atropine-like drugs, they block muscarinic receptor on ciliary muscle. The ciliary muscle will relax and therefore lens will become flattened. This lens will become flat. Instead of round, it will become flatter. Once it is flattened, it will be accommodated for far vision, i.e. يحصل failure of near vision. This is usually known as cycloplegia. Cycloplegia means failure to accommodate for near vision. The iris or the vision will be accommodated for far vision and cannot see near vision. Okay? So these are the effects of cholinergic drugs on the smooth muscles of the eye. They will affect two things. Will affect vision, or they will affect the intraocular pressure, and as we have seen, they have very important clinical applications. So, in summary, we can say that cholinomimetics or parasympathomimetics or acetylcholine-like drugs, whether they are direct acting or indirectly acting, they increase the contraction of all smooth muscles, including gastrointestinal tract, respiratory tract, urinary system, urinary bladder, and eye. On the opposite, cholinolytics or anticholinergic or parasympatholytics, They produce relaxation of all smooth muscles, including gastrointestinal tract, respiratory, urinary system, and the eye. This will have a very important consequences in different clinical indications and contraindication as we have described. In our next presentation, inshallah, we'll talk the effect of cholinergic and anticholinergic drugs on exocrine glands. I would like to thank you very much for your attention. If you like my presentation, don't forget to press like, and don't forget please to share with friends. Please subscribe to my channel. Wish you all the best luck. Wassalamu alaikum wa rahmatullah.